Hi, this is Dr. Cliff Grunseth coming to you another Dr. Cliff's Riffs. Today we're going to be talking about butt pain, a common ailment for many people. It was requested by several when we surveyed the audience what they'd like to hear about. So I'm going to go over some of the possible etiology or the sources of butt pain, things to consider if you have a pain in the butt besides your psychosocial factors. This is more medical-based butt pain that we will try to cover kind of in a broad overview just to give you an idea about how complex it is. So the butt is oftentimes complicated because there's many potential sources for buttocks pain. You oftentimes have pain that derives from the spine that radiates down. You can have it from the pelvis. You can have it from the hip joint. It could be muscles, nerve. So the approach to butt pain really depends on what the symptoms are. How did they start? What's the pattern of the pain? Type and character of the pain. Is it sharp? Is it dull? Does it get worse with movement, or is it just there all the time? Because of the complexity of the buttocks region, you can see all of the muscles and the nerves that are involved in the innervating and controlling the back and the buttocks. Sometimes it's very challenging to figure out exactly the source of the pain. Many times, probably the majority of the time from our experience, if you have just buttock pain, not so much the front groin pain, but rather the rear buttock pain, it's oftentimes a pinched nerve. It's oftentimes referred from the lumbar spine that radiates down into the buttocks, causing this pain in the arse without necessarily causing other symptoms. But because there's a gap between the spine and the buttocks, people think, well, it's not from my back, it's likely in my buttocks. But the bottom line is that many times the back pain will skip, and the pain will refer from a nerve to the buttocks. Sometimes the arthritis in the back will also cause a referred pain into the buttocks or the thigh. But many times if you've got this pain that is worse with sitting or standing, not necessarily every step you take, but with weight bearing, it many times is referred from the back because of some type of nerve irritation. Now, there's also a very common diagnosis of piriformis syndrome. There's a muscle that goes across the buttocks that controls some of the hip movement, but the likelihood of it being a piriformis muscle problem is very, very low. The piriformis muscle is a victim of the process. It's not usually the culprit. The piriformis muscle, if it is spasmed, is oftentimes getting irritated by something upstream, up in the spine. And so you always want to look higher in the spine just to see, is there something that's pinching a nerve that will cause the pain to radiate down into the hip. The other common ailment is bursitis. You can oftentimes have a little bursa in the hip. Here's a little illustration of a fluid sac, a bursa in the hip joint that is really there to just minimize or decrease the friction of the muscles as they glide through the hip joint. And that bursa will sometimes get irritated. Many people have bursitis of the shoulder, and many people have a bursitis of the lateral part of the hip, the greater trochanter, especially women, because women oftentimes have a little bit wider hips, and so they are prone to getting a little bit more pressure on the outside of their hips when they're side lying. And when you put pressure on that, directly on that bone, it'll irritate the tissue that's overlying that pointy part of the bone and cause irritation and a little bit of bursitis. The other possibility is that you've got a little bit of a tendon issue. And if you look at the tendons of the hip, there are two gluteal muscles. You've got the gluteus maximus muscle, which is the big butt muscle that controls a lot of the hip motion. but the smaller gluteal muscles, the gluteus minimus and medius, they attach to the outside of your femur, and they can sometimes get tethered and torn and weathered, and they can have little micro tears and things. So you have a tendinopathy, which means the tendons are not well. They can hurt, and that's a different source of lateral hip pain versus straight butt cheek pain. So the muscles and the nerves make it complicated. It really depends on where in the body or where in the buttocks you're hurting. Is it on the outside of the hip? Is it in the buttock of the hip? Is it down low on your sit bone, on your, it's called the ischial tuberosity, where your hamstrings attach? Those types of pains can oftentimes be determined by a good history and a good physical exam. Now, we're talking many times about chronic butt pain. If you've got an acute injury like this poor person, you can see that this type of injury is more of an acute injury, easy to explain. You obviously had some type of tissue damage causing some of this bleeding that occurred. It doesn't necessarily mean that it's dangerous, but it can be quite painful in the acute situation. But if you've got a chronic condition like osteoarthritis, where the joints start to wear out, then you can start to get kind of a hip pain or a buttock pain that's usually worse when you move your hip, walking on it, getting in and out of a car, anything where you're kind of torquing or twisting the hip joint, that will cause pain in the hip joint and sometimes refer to the buttocks. Sometimes the joint is completely worn out. In this picture, you can see there's literally no cartilage left in the hip joint, and so this would be an easy diagnosis with an x-ray, and eventually this would require a hip replacement if you had to. We would certainly try to use all the other treatment modalities to avoid surgery if possible. Many times if you strengthen up the surrounding muscles of the hip and try to adjust the biomechanics of your gait, etc., it might alleviate some of the hip pain without need for surgery. But if you have an end-stage hip, where we call it end-stage, where it's literally just bone on bone, nothing is going to really get rid of that pain except for a new hip. You can also have a fracture in this picture. There's actually a small little subtle fracture that may be present as well, and that can happen just spontaneously. You can have a hip which is very osteoporotic. In other words, the bone density is very thin. You can see these bones look almost ghost-like, and that is very prone to fracturing, to breaking spontaneously. The strength of the bone just can't handle the body weight, and it will break. Oftentimes the hip joint will break, the bones will break before you even hit the ground if the bones are so thin. But osteoporosis by itself does not hurt until something breaks, so it's a silent disease. So osteoporosis is not a cause of butt pain unless there was a spontaneous fracture, and what's called an insufficiency fracture from the osteoporosis. And then the other thing that we look at, the one thing we're concerned about are the zebras. The zebras are those diagnoses which are very uncommon but are still part of the herd, and it's something that you really need to make sure you don't have, so that you don't have what's called a red flag diagnosis. In other words, things that are dangerous. Those types of diagnoses include things that originate from the pelvis. If you've got an infection, a tumor, or something that is radiating to the buttock, you really need further workup. That type of pattern is going to present with pain that's not necessarily provoked with movement. It's oftentimes worse at night, and it can be associated with fevers, chills, weight loss, those types of things, more systemic problems. But the mechanical pain is oftentimes reproducible by moving the joint in a certain way. These types of red flag, worrisome conditions are oftentimes not necessarily movement related. You can also have what's called a complete collapse of the hip joint. People who take oral steroids and sometimes even injected steroids, but oftentimes with oral steroids, you can get what's called avascular necrosis of the hip joint. You can see this hip is no longer has a round head to the femur. It's collapsed down, and that requires a surgical intervention. The other big red flag that we always look out for is of course cancer. And cancer is basically oftentimes a silent disease until it hits nerves, especially in the bones. In this MRI, you can look at the bones and you can see that they just appear a little bit mottled. There's different little mosaics in the bone, and this is classic for a cancer, and that can, in theory, cause butt pain. It can also cause other pains in the pelvis, etc. But you always want to rule everything out. Make sure by history and physical exam and just general probability that you don't have something that is a red flag condition. So the bottom line is that sometimes you have to go to imaging above and beyond the history. You have to go to X-ray, MRI, ultrasound. We do a lot of ultrasound diagnosis here in Spine West to diagnose some of the tendon tears and things. And the puzzle to find the source of the pain is, like I said, often complicated. It can come from the spine. Oftentimes, pure butt pain is from the spine, but it may originate from the buttocks area itself. So I hope that helps you. The key is find somebody or find a clinic that you trust so that you can get proper diagnosis and evaluation. Find out if you have one of the red flag conditions, because that's something you want to jump on early. And you're always welcome to come to Spine West, where we look at the whole person, the whole system, very carefully look at the history, physical exam, the diagnostic imaging, and everything pieced together to try to figure out what may be causing that pain in the backside that you may have, so you can get back out there, enjoy nature, and enjoy your life. I hope that's helpful for you. We'll see you next time. Let us know if you have other topics you'd like discussed. Take care.